Hi, everyone. Dan Eisner here from ZLC Employee Benefits Solutions. My passion as an employee benefits advisor is to find better ways for employee benefits different from those used for the past 20 or 30 years. And it's this passion that drove me to develop the Better Benefits podcast series. Along with my passion, I leverage my relatively unique profile, having almost 25 years experience as an employee benefits advisor and being the only chartered professional accountant working in this industry in the local market. In this episode of the Better Benefits podcast series, I'd like to talk again about obesity and talk about how and why it seems appropriate to use guilt as the first line of therapy for obesity. Look, there have been significant developments around effective weight loss drugs, and Canadian insurers are also developing proactive protocols to manage these drugs. So, isn't it time for plan sponsors to reassess their support for employee obesity and how that fits into broader well being? Okay, let's get started. It's widely recognized that Canadians are less healthy than they've ever been, with an increasing proportion being overweight, obese, or morbidly obese. According to Statistics Canada, almost two-thirds of Canadians aged 18 and over are classified as overweight or obese. Realistically, this situation is unlikely to change anytime soon. Healthcare practitioners generally agree that there is a direct link between obesity and other serious health risks, including, but not limited to, diabetes, cardiovascular disease, stroke, chronic pain, certain cancers, and mental health conditions such as anxiety and depression. Despite this, obesity is often treated differently from other chronic diseases. Healthcare practitioners acknowledge that obesity truly is a chronic disease, yet it's rarely given the same level of medical attention and treatment as other chronic diseases. As such, shouldn't it also be put on even footing with other better known chronic diseases in terms of first lines of medical treatment? Unfortunately, that just isn't the case. Many still believe that obesity is a lifestyle issue or believe that individuals brought it upon themselves through poor choices around diet and exercise. We would never consider guilt as an acceptable approach for other chronic diseases, nor should we approach obesity with the same perspective. The good news is that the new class of GLP-1 agonist medications are showing that obesity can be medically treated, yielding tangible results for many people. New data in 2024 from the U.S. National Health and Nutrition Examination Survey revealed that the U.S. adult obesity rate decreased by about 2% from 2020 to 2023. And researchers attribute this decline in part to the increasing use of GLP-1 drugs. It appears that these medications may be helping to reverse the long-standing rise in obesity rates in the U.S., and the same trend could likely be expected in Canada. Ozempic is arguably the most notable GLP-1 agonist drugs. It's a drug that few people knew about just a couple of years ago, but it's since become a household name, particularly within the employee benefits industry. However, its rapid rise in prominence has brought both praise and controversy. While Ozempic and similar GLP-1 drugs have proven highly beneficial for diabetics, their use for weight loss has sparked a significant debate, highlighting the ongoing stigma around obesity and the potential benefits of weight loss drugs. Many have argued that the problem is cost. Unfortunately, there's no comprehensive data that I'm aware of around the effectiveness of reducing drugs in reducing utilization for other items that are currently covered by employee benefits plans. Could the use of weight loss drugs reduce claims related to, for example, prescription drugs for blood pressure, cholesterol, and depression? Reduce costs for medical supplies for things like CPAP machines, knee braces, and wheelchairs. Reduce costs for paramedical practitioners for massage therapy, physiotherapy, chiropractic care, and mental health support. On a positive note, some Canadian insurers are developing proactive prior authorization protocols for these GLP-1 weight loss drugs to help mitigate costs. These protocols restrict eligibility to individuals that meet certain BMI levels and/or having obesity-related comorbidities. Additionally, they require individuals to engage in nutrition and fitness programs. Most importantly, they specify that coverage will actually end if specific weight loss targets are not achieved. Note that the specific requirements vary by individual insurer, but these proactive protocols should be applauded, especially given that Many other high-cost medications do not have similar protocols, nor do they have any criteria to actually end coverage. Beyond the healthcare perspective, there's also potentially a legal dimension to consider. While obesity is already recognized as a chronic disease by the healthcare community, many may be surprised to learn that obesity, in certain cases, might also be classified as a disability under Canadian law. There are growing discussions that making employment or benefits decisions based on weight, particularly in cases of obesity, could be found to be discriminatory. Could that mean that excluding GLP-1 weight loss drugs from benefit plans would be seen as indirect discrimination? Don't know. While no discrimination claims related to GLP drugs have yet surfaced, we do recall that there were similar legal challenges that arose when medical marijuana became widely accepted and legally recognized as a treatment for various ailments. There's no doubt that Ozempic and the broader class commonly known as GLP-1 agonist drugs have had a profoundly positive impact on the health of diabetics, with many of them losing weight. While it's still early days, there's growing evidence that these GLP-1 weight loss drugs can lead to positive health outcomes when accompanied by nutrition and exercise support. The key for employee benefits plan sponsors is to have some confidence that the right employees are getting the right drugs at the right time, ultimately improving overall health outcomes and reducing benefit plan costs in the long term. The new proactive protocols being implemented by some Canadian insurers appear to provide this reassurance, and we hope that all carriers will adopt similar programs. Now, the vast majority of plan sponsors believe in supporting employee well-being, although the definition of well-being might vary. However, in general, they share a common goal in ensuring employees feel valued and cared for by their employer. These employers now need to determine if their definition of well-being includes helping employees dealing with obesity. Currently, the majority of plan sponsors in Canada do not cover weight loss drugs. If they do want to cover these drugs and their current insurer does not cover them, nor do they have proactive protocols, should they look at maybe changing insurers? Ultimately, these decisions will be driven by different factors over time. In the short term, they're being driven heavily by moral considerations. In the midterm, they'll likely be driven by financial grounds, particularly once more data becomes available, and quite possibly in the long term, be driven by legal grounds. All that said, I hope we can all agree that guilt is not an acceptable first-line therapy for those people dealing with obesity, arguably the most prevalent chronic disease in Canada. Okay, you've now heard my thoughts and opinions, so please let me know what you think. How does this compare to what you're hearing from your current advisor or other advisors in the market? And as always, I'm really interested to know if there are other current topics that you'd like to see me cover in future podcasts. Let me know what's bothering you, keeping you awake at night with respect to your employee benefits plans. Thanks for joining me today. Be sure to follow me on my LinkedIn business page, which is Dan Eisner, Employee Benefits Advisor, and you'll get a notification on the next Better Benefits podcast. All that information will come up on the screen in a second. Thanks so much.